Hello, everyone. We are group number 6, and our team members are Jessica, Jennifer, Keely, and Sierra. Today, we will be presenting case study number 1, a collaborative systems approach to healthcare from the health systems thinking. This case focuses on how a coordinated systems-based approach can improve the management of chronic illness, specifically in a culturally diverse refugee population. Throughout our presentation, we will explore how systems thinking is applied in this case, examine the roles of key stakeholders, and analyze how collaboration, technology, and community partnerships contribute to improved health outcomes. We will also connect this case to broader course concepts and discuss its relevance to healthcare administration and policy.
The summary of our case includes a young Somali refugee woman named Amelia with juvenile onset diabetes that is managed through a coordinated interprofessional healthcare system. Her blood sugar readings are electronically transmitted. They trigger real-time system responses and care coordination as well. Care is delivered through a complex adaptive system where providers, technology, and community partners continuously interact with one another. And the case demonstrates a holistic, patient-centered approach that aligns with systems thinking's focus on the entire system rather than just isolated parts. Regarding the healthcare context, care is delivered through a federal qualified health center integrated into a larger regional health system. Partnership includes healthcare providers, a university, and the Somali Community Development Alliance, which forms a system of systems. Services span multiple settings, including community, ambulatory, acute, and transitional, reflecting interconnected subsystems instead of just siloed care. Lastly, the model aligns with the triple aim, which is a key systems thinking outcome, and it improves patient experience, population health, and reduces costs. As far as our key stakeholders go, we have Amelia and her family, who are central participants within the system. We have an interprofessional healthcare set of teams that show and prove that interdependence is vital. We have a federal qualified health center, including staff and a regional health system board of leadership that supports system structure and coordination. We have a university faculty and students contributing to a learning health system in the study. And lastly, we have the Somali Community Development Alliance that stands for community and cultural integration within the system. Some of the central challenges that we saw include managing a chronic condition, in this case it was diabetes, within a complex culturally diverse population. We also had issues ensuring effective communication and culturally competent care while highlighting the importance of information flow. Coordinating care across multiple providers and settings while avoiding fragmentation as well. Then we have addressing social determinants of health that influence outcomes beyond clinical care. We have responding to patients' needs through feedback loops, including alerts, interventions, and follow-ups, which would be extremely helpful. And lastly, we have continuously adapting care processes to reflect a dynamic and evolving healthcare system rather than just a static model.
This case exemplifies systems thinking by demonstrating how multiple components within the healthcare system interact to generate outcomes, rather than operating independently. Interdependencies are fundamental to the system. Amelia's care relies on coordination among healthcare providers, technology systems, and community partners, including the Somali Community Development Alliance. Each component depends on the others, so no single element can function effectively in isolation. Feedback loops facilitate continuous improvement in care. For instance, Amelia's blood glucose readings are transmitted in real time, which triggers alerts and prompts immediate team intervention and follow-up. This process establishes a reinforcing loop in which timely responses enhance health outcomes and decrease complications. The system structure enables integration across multiple care settings, including ambulatory care, community-based services, and acute care. This integration reduces fragmentation and facilitates more coordinated, patient-centered care. The system also produces unintended consequences. It requires substantial resources, relies extensively on technology, and may be challenging to implement in under-resourced settings. Collectively, these systems interactions result in emergent outcomes such as improved diabetes control, reduced hospitalizations, lower healthcare costs, and enhanced health equity. These outcomes arise from the system operating holistically rather than from any single intervention.
This case illustrates many concepts we have covered so far in class. Amelia's care takes place within an integrated delivery system, including an FQHC, a University Health Sciences program, and a regional health system, highlighting the configuration and complexity of the U.S. healthcare system. Her access to care is shaped by health policy, including FQHC funding and eligibility for public programs. The system's coordinated response to her elevated blood sugar exemplifies systems thinking as real-time data triggers action amongst multiple professionals with diverse skill sets, supported by technology and feedback loops. We also see organized effectiveness in action with reduced costs, fewer hospitalizations, and improved population health outcomes. Finally, the partnership with the Somali Community Development Alliance reflects social sector leadership, emphasizing cultural competence, trust building, and community engagement. The case of Amelia aligns clearly with the learning objectives covered thus far. The system demonstrates strong social sector leadership by integrating community partners and building culturally responsive care models. Amelia's care model is enabled by health policy, FQHC funding, Medicaid coverage, and ACA supported care coordination. Public programs such as Medicaid and ACA provisions directly shape the structure and financing of the care she receives. These connections illustrate how policy, leadership, and delivery systems interact to influence real-world patient care. Amelia's case is important because it shows what's possible when policy, leadership, and systems thinking align. The system achieved the triple aim of lower costs, enhanced patient experience, and improved population health. It also demonstrates the effect of interprofessional education and culturally competent care, especially for vulnerable populations such as refugees. For health systems leaders, this case is a compelling example of how integrated systems can improve equity, optimize resource utilization, encourage partnerships, and build trust within the communities. It shows that when systems are intentionally designed through policy alignment, community partnerships, and strong leadership, they can deliver exceptional outcomes. This is a practical example of how these concepts interact in real-world healthcare settings.
Hi everyone, today I'm talking about Amelia, a young Somali woman with juvenile onset diabetes. Her care is managed by a team made up of medical, nursing, pharmacy, and occupational therapy students, along with a community health worker from her own community. This case shows how coordinated community-based care can improve patients' outcome while lowering costs. Her blood sugar is monitored remotely and transmitted to her care team at a federal qualified health center where the team is alerted to any changes. They respond quickly by contacting her in her own language, adjusting her medications, and ensuring she receives the care she needs. This demonstrates how teamwork and technology supports chronic disease management through early intervention and prevention of complications. Another important aspect is cultural and community. The Somali Community Development Alliance partners with the healthcare team to make sure her care is respectful, trusted, and easy to follow. The team also works closely with the university, which trains students to work together and understand different cultures. The triple aim is reflected through improved patient experience, enhancing population health, and reducing costs. Using these ideas, the clinic has reduced costs by about 20% while also decreasing hospitalizations and emergency department visits. This shows that team-based care, supported by technology and community partnership, improves patient outcome, reduces costs, and creates more equal health outcomes for everyone. From an administrative perspective, there is a need for systems that support team-based care and digital health tools. Leadership plays a key role in allocating resources, supporting team-based care models, and telehealth services. Leaders who encourage teamwork can improve patients' trust and overall care quality. Effective leadership plays a key role in success. There is also important implications for health policy. It highlights the need for policies that support funding for federally qualified health centers, community health workers, and education programs. In addition, reimbursement for telehealth and remote monitoring services makes it more accessible and sustainable to patients. In terms of practice, patient care is improved through early intervention, continuous monitoring, and cultural appropriate communication. From a strategy standpoint, healthcare organizations can form partnerships with community groups and academic institutions to strengthen workforce training and improve population health. At the system level, integrating team-based care, technology, and community engagement leads to fewer hospitalizations and lower healthcare costs. In conclusion, this case shows that when we combine teamwork, technology, and cultural support, patients achieve better health outcomes and healthcare system becomes more efficient.